and welcome to another show. You know, we're starting to hear a lot about artificial intelligence these days, aren't we? AI giving doctors advance notice on heart failure. Can you imagine that? In fact, Northwestern Medicine Bluhm Cardiovascular Institute is using AI to detect at-risk patients. In fact, cardiologists at Northwestern Medicine are using artificial intelligence to identify patients with advanced heart failure who require specialized care. Now, including those that might need a ventricular assistance devices or transplant. So heart failure is a common, costly condition affecting over 6 million U.S. adults. Now, that's about 1 in 250 people. So when a patient reaches advanced heart failure, medications no longer work. And that's why it's vital to catch the problem early. So my very special guest is Dr. Faraz Ahmad MD, MS cardiologist, an associate director of Northwestern Medicine Bluhm Cardiovascular Institute Center for Artificial Intelligence. Doctor, up to 25% of all heart patients have advanced heart failure. I mean, Doc, how common is heart failure?
All right, so heart failure, thank you so much for having me. I'll start with, so heart failure affects over 6 million U.S. adults currently, and its impact really is only expected to grow. By 2030, it may impact over 8 million U.S. adults, and that's 1 in 33 people. Now, of those 6 million adults who currently have heart failure, as you said, up to 25% may have advanced heart failure, which is defined as persistent severe symptoms of heart failure despite being on already the best treatments available.
Yeah, I mean, the numbers, they're starting to get a little scary. I mean, how is AI giving doctors advance notice, though, on heart failure?
So here at Northwestern and in our Center for AI, we wanted to be proactive in the management of our patients with heart failure. We recognized that across our health system, we have a ton of data being generated every day from our millions of patients we see here. And so we partnered with engineers in our health system, develop an AI algorithm to try to find these patients with characteristics of advanced heart failure across our system who are not already being seen by a heart failure specialist. And then we developed an entire workflow that involves a nurse reviewing the AI model output, contacting the patient's clinical team and ultimately the patient, and then bring them into these special clinics we stood up to get them in as soon as we can for heart failure specialty care with our interdisciplinary team. Once they come to our clinic, they undergo a full evaluation. We discuss their history, their current symptoms, their quality of life, and goals. We look to see if there are any changes to their medications, any additional procedures or devices we can offer them. And for a subset of patients with advanced heart failure, they may potentially benefit from these advanced therapies we have, like heart transplant and heart pumps. And so for those patients, we have a discussion about those therapies. And if it aligns with the goals of the patient, we start a formal evaluation with our team for those types of therapies.
So, Doc, tell us, for the layman, what exactly happens when a patient reaches advanced heart failure?
So when patients have sort of chronic heart failure, they can have some symptoms of heart failure like shortness of breath, fatigue, and some other symptoms as well, and they sometimes are hospitalized. But when they reach advanced heart failure, the symptoms are pretty severe, and they pretty much happen all the time, multiple times during the day. And this is on the best therapies available already. So once they reach this stage, it's really important, and this is in the guidelines as well, is to get them to see a heart failure specialist for evaluation for these advanced therapies or other therapies, or even just discussion of their goals of care and how to keep them feeling as well as we can for as long as we can.
So the steps needed, to be taken to help in a case like this. What about lifestyle changes? Does that come into it as well?
So I would say overall for heart failure, for both people with chronic heart failure and advanced heart failure, lifestyle changes always help. I think a heart-healthy diet, and you can discuss the specifics of those diet with your clinical team. I think exercise, staying active, trying to stay as strong as possible. For some of our heart patients, we do actually recommend cardiac rehab as a way to get them feeling better and stronger. So I do think lifestyle is important. Often our patients who do reach advanced heart failure, there's more benefit ultimately from some of these other treatments we can offer. But with that said, I do think lifestyle is important across the whole spectrum of heart failure and really the spectrum for everyone. I think for whether you have heart failure or other cardiovascular conditions or even or don't have any chronic conditions. Lifestyle is really important to staying healthy as long as possible, and even preventing the development of heart failure and other heart conditions.
Yes, very true. So what about new options? Are there any new options, in sight?
Yeah, there really are. I mean, there have been a lot of advances in the heart pump technology. So these pumps now last a really long time. Patients do really well with them and have a high quality of life. For some patients with certain types of leaky valves, we can now offer new minimally invasive treatments to fix these valves that weren't even offered a few years ago. So there are really new treatments coming all the time in heart failure. There's also, in addition to sort of devices and trial and procedures, there's also been a number of new medications that have been developed and tested recently. And so once patients undergo this evaluation with our team, we evaluate them for all these things and see if any of those can help them feel better, live longer.
Well, data science teams are using tens of thousands of data points from their data warehouse, which include clinical data, imaging. Tell us about, with the artificial intelligence, what else, are you using this for to help patients?
Yeah, so we have a number of projects and partnerships with industry to help us develop and test these technologies. For example, working with one company to look at echocardiograms, which are images of the heart, to identify rare causes of heart failure. Working with another company to try to help them reimagine how the stethoscope works, using AI to process those digital audio files and then diagnose valve problems earlier. Another company, we're working on home sensors, and can we use home sensors to try to figure out when patients with heart failure are getting worse before they come to the hospital and treat them at home. So I think there are a number of opportunities for AI. I will point out that it's still the early days of the adoption of this technology in healthcare. And we've seen AI already make a big impact outside of healthcare, but I think it's important as we develop these technologies and test these technologies that we do it in a rigorous way and build the evidence base to use them. And that's in part why the FDA has such a rigorous program to help evaluate these technologies.
Yeah, I mean, it seems like we just woke up one morning and all of a sudden artificial intelligence is in every darn thing.
Right. No, I totally agree. It feels that way, certainly in our daily lives. And I think in healthcare, we'll see it more and more. And we just need to be systematic and thoughtful in the way we do this.
Now, people can pre-read and get organized. Is there anything, if somebody, is listening to this and says, well, I'm at home, if I went to your site, which is heart.nm.org, what am I going to read that may be able to give me some advice or give me some, clues that maybe I need to do something? Is there something they should look for on your site to read?
Yeah, that's a great question. There's a lot of information in general about cardiovascular conditions and how to stay healthy from a heart standpoint. There's a lot of descriptions and information about the different type of specialists we have and care we offer. There's a whole section on clinical trials we offer for different heart conditions. So if you already have a heart condition, you can look for that. You can search by that condition and look see if there's a trial that could help you, because we have a number of studies that can really help patients and push science forward in the space. So there's a lot of really helpful information on the website at heart.nm.
Well, I've got a left bundle block, Blanche. I was told, a couple of years ago that I may or may not ever need a, pacemaker. I could go all my life without one. Please tell me that there's some good news about that.
Well, there really is. And if you go to our website, you can look at our, you can see the information about heart rhythm problems and our heart rhythm specialists. But the pacemaker technology is evolving more and more too. The ways we can monitor the heart now for rhythm abnormalities. You've probably seen things like the Apple Watch and Fitbit coming out with algorithms. That's not necessarily for the problem you're talking about, but certainly for atrial fibrillation, there are ways we monitor it that way. There are newer patches we can use to try to find heart rhythm problems. And then even the pacemaker technology itself continues to evolve and getting smaller and smaller. So there are a lot of really great options currently, and even more coming down the pipeline.
Fabulous medicine. Well, you do a great job, Dr. Faraz Ahmad. He's an MD, MS, cardiologist, and associate director, by the way, of Northwestern Medicine Bluhm Cardiovascular Institute Center for Artificial Intelligence. Great information. Thank you, Doc. And again, heart.nm.org, correct?
Correct. Yeah. And thank you so much for having me.
You're most welcome. Very interesting indeed. Thank you for taking some time out for us. Goodbye.